All right, and welcome back to ABA Exam Review. Today is an exciting day because today we get to update our RBT Exam Study Guide video, and we are going with the third edition. The third edition will come into play in January of 2026, so if you're watching it today and you're preparing for your test, let's say next year, this is a good place to start. If you are watching it in the future and it's already 2026, this is where you want to be. If you're still going to be testing in 2025, since we do have a little bit left in 2025, be sure to check out our second edition video, which is linked below. But starting with the new task list, be sure to come here for the third edition. This study guide will be included in the combo pack on the website. So when you do purchase that, you'll get both the second and third edition study guide for your convenience. What we're going to do in this video, just like our second edition video, we're going to go through each task list item one at a time. I'm going to break them down, give you examples, and we're essentially covering everything and anything you're going to need or see on the RBT exam. So settle in, let's learn, let's have a little fun. As always, we're going to work hard, we're going to study hard, and let's get going. So let's start with Domain A, data collection and graphing. And something important to remember if you've been in the field a while or you've been preparing for your test a while, or maybe you're taking it again, whatever the case, the task list has been adjusted and changed, but the changes aren't all that dramatic and the overall ideas and terminology are no different. The science is still the science. So we're going to start with measurement because everything we do is driven by data. Our decisions are based on data. And the most common type of data collection we use is considered continuous measurement. Continuous measurement means we record every occurrence of behavior. If you have a 2-hour session and you're continuously recording, then every time it happens in 2 hours, you're going to record that. If you have a 4-hour session, every time it happens in 4 hours, you're going to record that. It is the most accurate way to collect data. It can be challenging because it does take a lot of time and intensive work. And that's a lot of times why we do one-on-one therapy, because it allows us to do things like continuously measure. What are our main types of continuous measurement? Well, let's start with the easiest one, frequency or a count. You are simply asking how many times. So we can do this with, let's say, tally marks. Johnny eloped 10 times, we would count 10 times. Very straightforward, very simple way to measure how often a behavior occurs. Duration is the time, kind of not equivalent, but the kind of parallel to frequency and count. And so when you're taking your exam, you're going to want to look for these words like how many versus how long. How many implies we are looking at a number of responses, where how long implies we're looking at an amount of time. So our time-based measurements are going to be duration, latency, and inter-response time. Duration is simply the length of time a behavior lasts. So tantrum lasted 5 minutes. Susie read for 7 minutes, right? They worked for 3 hours. Simply the beginning to the end of one response or behavior, from the onset to the offset. Latency. Latency is the time from instruction to response, meaning the SD to the first response. So for instance, sit down, 4 seconds sits, our latency is 4 seconds. Now, if we want to draw that out, we can look at the SD to the response, which is our latency. So what would be our response 1 to response 2? Time in between these, that's going to be our inter-response time. And our duration is the length of each response. So it's an easy way to remember all our time-based measurements. So once again, duration, the total length of each response. Latency, time from the instruction to the first response. Inter-response time, time between same or similar behaviors in the same response class. So 13 seconds between screams. There's 13 seconds from scream 1 to scream 2, scream 2 to scream 3, so on and so forth. And finally, rate. So rate and frequency are often used interchangeably, but they are slightly different. Whereas frequency is just a count, rate, we're adding a time component. So if I count 5 for my frequency and my time is 1 minute, well, that'll be my rate, 5 times per minute. Or if we have 15 over 3 hours, we have 5 per hour. So it gives it a little bit more precise data on a count. Yes, it does have time, but this is rate kind of stands alone as far as combining frequency and time. You're really thinking of duration, latency, and IRT as time-based. Frequency or count is a response-based, and then rate is frequency over time. Continuing, discontinuous measurement. Now, discontinuous measurement means we're only taking the sample of a session or a behavior. So if I have a 3-hour session, I might discontinuously measure for 20 minutes of that session, break that into intervals, let's say 1-minute intervals for 20 intervals, right? So continuously would be for all 3 hours. Discontinuously would be only 20 minutes of those 3 hours. We might use this if the behavior happens at a very high rate. If we don't have time or resources to observe for 3 hours, if we're in a group setting, there's many reasons to use discontinuous measurement. Now, it isn't as accurate as continuous, obviously, because 3 hours of data versus 20 minutes, 3 hours is typically going to be better, but it's still very useful. So let's think about our different types. We have partial interval, whole interval, and momentary time sampling. Now let's say we have an interval here. This is our interval, and let's say it is for 1 minute. If we're looking at partial interval, the behavior has to happen at any point during this interval, okay? So if it happens 2 seconds in, we count it for partial. If it happens 59 seconds in, we count it for partial. Now remember, with this continuous measurement, we're only recording one response per interval. So either it happened or it didn't, right? Now, what does that mean? It means that we tend to overestimate or underestimate behavior when we are only taking one data point, because if we have a 1 minute interval and that behavior happens 20 times, partial interval is only going to show one response, right? So we're looking at a situation where we are often overestimating with partial interval. On the other hand, right, because if we have a 1 minute interval and that behavior happens for a split second, well, now it looks like the behavior is going to happen for that entire minute. So understand the drawbacks. Now, what is whole interval? Well, whole interval is only if the behavior happens the entire time. So if the behavior happens for an entire minute, the whole time, that's whole interval. Why does it underestimate? Well, if this behavior happens for 59 seconds, whole interval is going to receive an X. Even though it happened for 59 seconds, our data are going to show it didn't happen at all. So our example for partial, one scream in 30 seconds, mark it. Whole interval must scream full 30 seconds. Momentary time sampling, we're looking at the end of the interval, right? Right at 1 minute at the very end. And at the end of that interval, you'll look up and check, did it happen or did it not? Now, a lot of times it does underestimate, but it can also overestimate. It just depends on did the behavior happen or not at this specific point in time. So quickly, partial interval, if it happens at any point, any part of the interval. Whole interval, it's got to happen in the whole interval, the whole time. Momentary time sampling, it has to happen at the very last moment of that interval. And those intervals are going to be decided based on assessments and what your BCBA or supervisor think. Permanent product, we are recording the tangible result of behavior, not the behavior itself. No observation of behavior is needed. Typically, the easiest, if we can make it work, because we don't actually have to observe the behavior. Well, why is that? Because all we're looking for is what the behavior produces. What is the outcome of the behavior? If we need to look at completed worksheets, we don't need to watch that the person worked the entire time. We can check the completed worksheets and grade them or whatever it may be. Test scores, same things. What about items assembled? I want you to build 3 puzzles by the time I come back. I don't have to watch them build the puzzle. I can check the puzzle. Clean room. I tell you to clean your room. I can go and check, was your room clean? I give you a grocery list. Did you get all the items? So on and so forth. When does permanent product not necessarily always work? Let's say we have self-injury, and the self-injury doesn't always leave a mark. Permanent product might not be that accurate because we can't consistently measure the same thing over and over again. However, if you can use permanent product, it's very straightforward, right? You're not observing the behavior, you're just looking at the result or the outcome or the product of that behavior. Data entry and graphing. Let's not overcomplicate data entry and graphing. If you're familiar with our second edition, we used the same exact graph. This is what you need to know for graphing on your exam. And luckily, these days, a lot of your graphing will be automated, but you just want to know some general ideas. So how's our graph set up? Well, the y-axis, or the ordinate, you should know that, okay, you want to remember that, is our behavior. It's our dependent variable. This is our y-axis here. Our x-axis, or the abscissa, I can never say that word, is our time, or our sessions, or our independent variable. This is here, okay? We're implementing or measuring what is happening to the behavior over time, right? And so what we're looking at is how does the dependent variable impact that independent variable, or over sessions or over time, right? And what we're looking for are a few things. We're looking for trends. So let's look at data points 1, 2, and 3. What is that trend? Well, it's flat. There is no trend. 4 to 5. What is our trend here? It's upward. 5 to 6, downward. 6 to 7, up. So we have flat, increasing, decreasing, increasing. We're also looking at variability. How much does the data bounce around point to point? High variability can mean consistency in implementation, maybe something going on in the environment, maybe we're not effective. What would you say about variability for 1, 2, and 3? Well, there is none. The data is not bouncing at all. However, 4 through 7, that data is all over the place, right? Our highest is 8, our lowest is 2. And trends are all over the place, extremely variable, hard to tell or get an idea of how the behavior is actually trending. It's going up, but then it plummets, then it goes up again, okay? If you can understand that, and just reading a simple line graph, then your visual analysis becomes very simple. But you do want to remember each part of these graphs, right? We have our y-axis or behavior, our x-axis is our time, our title, and then we have what we call a condition change line. Notice that the data points are connected. Why do we have this condition change line? Well, maybe this was baseline, this was intervention, and then we just visually analyze it. And that's literally how we look at these graphs. You look at the graph and you make or you draw conclusions based on what you see. That is visual analysis. How to practice this? Just look up a few graphs and get good at identifying trends and variability. A4 should be very straightforward by the time you get to your exam day. A5, observable and measurable descriptions. Now, we've talked about measurement, and what are we going to measure? That's what we're talking about now, because before we can choose a measurement system, we need to know what we're measuring. What do we mean by observable and measurable? Observable means it's a public event, or we can see it with our eyes. Okay, so it's not an internal thing. It's also measurable. Can we reliably and consistently and accurately measure a behavior? If we can't, we need to either define it or choose a different behavior. What are some wrong ways to describe behavior? Johnny was aggressive. Why is that bad? Well, what does that mean to be aggressive? It could mean anything. It could be anything from throwing a piece of paper to getting in an actual fight. What about felt angry? This word felt is tricky and often something you might want to avoid in your descriptions, right? Because that's very subjective. Maybe the client didn't feel angry. Maybe they felt sad and you perceived it as angry. Maybe they were happy. They just weren't outwardly happy, okay? What's a better way to describe aggression? Johnny hit his brothers 5 times with closed fist. That's a good way to describe it. Why does this matter as an RBT? Well, whenever a new behavior occurs and you're asked by a supervisor or a BCBA or whoever it is, parent, whatever, you're going to want to describe it using a measurable and observable description so we can get the most complete information possible. How about client felt angry? Well, how about Sarah threw 3 toys across room in 10 minutes? We're not labeling Sarah's behavior as anger or frustration or boredom or whatever it may be. We're just saying what she did, okay? And that's really what it comes down to. Describe what you see, describe what they did, not what you think or what you think they feel, okay? In casual conversation, it's okay to discuss, quote unquote, the feelings of your clients. But when we're actually trying to describe things and work on measuring behavior, we want to be as accurate and precise as possible and describe exactly what we see. Two main things to include: topography. What does it look like? And maybe consider function. Why do you think it occurred? Obviously, we can't be sure about the function without further assessment, but you can at least consider your ABC, your antecedent and your consequence, and make a hypothesis to help further along the assessment. A6, calculate and summarize data. These are going to be basically the three main types of calculations you're going to need to do, and they're very straightforward, very simple math. We already talked about rate, right? It's frequency over time, very easy. Divide your frequency by your time and you get your ratio. Mean duration, what is that? Well, that's an average, right? So it can be, you could take an average of frequency, you could take an average of duration, you could take an average of anything you've measured. How do you do that? You take your total number of data points, okay, divide it by the number of data points you collected. So here's your total data, divided by 3 total data points, and you get a 10-minute average. If we have frequency, and I got 2 plus 3 plus, I don't know, 3, all right? And that adds up to 8. We would divide that by 3, and that would be our average. Just have to do that a few times. You might already know how to find an average. If you do, great. Very simple. And then percentage, okay? Count divided by total opportunities times 100. So 8 correct divided by 10 trials equals 80%. How many percent did they get right? And why do we multiply it by 100? So we can get up to this percentage, okay? So these are your main 3 calculations you need to do. My suggestion is just when you're studying, do 1 or 2 of each until you feel very confident and fluent in those. Because if you can get there, then these questions become very simple. Averages are not hard. Percentages and rates are not hard to calculate. You just have to understand how they're done. And it becomes very intuitive, right? If I asked you to give me a percentage, you probably could do that pretty easily without thinking about this whole formula. So don't overcomplicate anything. A7, identify trends. So we just talked about our trends on our graph. Different types of trends mean typically different things, right? Let's think about an ascending or an increasing trend. So we have a situation where our data might be trending upwards, right? It's good for desired behaviors because we're increasing ever so. It's not going to be great for problem behaviors because we're increasing. What about descending? Well, it's going to be the opposite, right? We might start here, we go down. Obviously, you're not going backwards, but you get the idea. We're descending here. Pretty good for problem behaviors, bad for desired behaviors. And these are all generalities. It's going to depend on the client and the target behavior, but this is the idea. Stable or flat typically means we're in maintenance. The behavior is not changing. It's just chugging along session after session, day after day. Okay, typically good when we want behavior to not change, bad when we want behavior to change. And then a variable trend might be something like this. Go back down, shoot up, down, up. Okay, what does this really say? It's hard to tell, right? It's all over the place. It's bouncing all around. It's very inconsistent. Don't try to draw a lot of conclusions from this data. It's very bouncy. We want something steady and consistent. A8, risk of poor data and fidelity. All right, so this is going to be a big section. What is fidelity? Let's start there. You've probably heard that word maybe from your BCBA or supervisor. It just means, are we doing what we said we would do, and are we doing it right? So are we implementing the intervention accurately and consistency as it was designed in the treatment? So if your behavior plan says we need an FR5 schedule 4 correct responses. Integrity means every 5 responses, we reinforce. Poor integrity would be every 3 responses, and then every 6, and then every 9, and then 5. We're not following the plan. So fidelity just means we're following the plan to the letter or as close as possible. Why do we want to do this? Well, we want our data to be consistent. If we have 3 RBTs on a team, I'm doing it one way, you're doing it a different way, and the third RBT is doing it their own way, that data is going to be inconsistent all across the board, and our decision making is going to be off. So we need to be consistent. What does unreliable data lead to? Well, incorrect treatment decisions. If I show from my data that behavior is increasing and my fidelity is poor, well, we might implement something to decrease the behavior that isn't actually occurring. What about continuing ineffective interventions? As we saw in our variable graph, if the intervention isn't effective, we want to know that too. We're not always going to be effective with our interventions, but it's important to know that. We might stop effective interventions on accident because the same issue here, data may indicate no change when there is a change. And we're not measuring true progress. So your fidelity has to be spot on. Your data collection, you have to try to be perfect, and nobody's perfect. Get that. We're working with humans and difficult environments sometimes. You want to be as precise as possible because data are everything. Poor procedural fidelity causes, well, we don't know if the intervention doesn't work or we just implemented it wrong. If you've ever worked with somebody who's just not doing something correctly and they say, well, it's just not working, in your head, what are you thinking? Well, it works, you're just doing it wrong. And that is fidelity. Inconsistent client results from poor fidelity, slower to no progress, potential harm to client. Remember, everything we do and what it all comes down to is our number one priority is helping the client as much as possible. And if you were doing that, you're doing your job effectively and well. And the only way we can do that is to get good data and implement with fidelity. All right, on to domain B, behavior assessment. It's going to be 11% of your exam. And with that, we are going to start with preference assessments because as an RBT, you're going to be doing preference assessments all the time, not just at the initial assessment, but every day I would recommend some sort of casual preference assessment. What are they into that day? What do they like? What do they not like? It's a good way to kind of test out motivation and what you can use that day. What are our different types? Let's start with the free operant, okay? Put out multiple items. In other words, we're just allowing the client to engage with items. We're not arranging them. We're not making them choose. We're essentially being child-led, okay? This is child-led. What are they engaging with in the environment when nobody is giving them instruction? Pair stimulus, also called forced choice, is present 2 items at a time, okay? So if I have A and B and C, I would first choose A and B and then present C and A and then maybe B and C. And we would see, okay, which item is chosen. They chose B, C, B, okay? It creates a little bit of a hierarchy, right? This would say B is number 1, followed by C, followed by A. Then multiple stimulus with and without replacement. So when you're trying to think about your assessment on the exam, single choice is going to be 1 stimulus, paired is 2. Typically, multiple stimulus is 3 plus, okay? And that's a quick way to kind of identify what assessment we're using. Now, if we have multiple stimulus with replacement, and we have A, B, C, and D, and the client picks D, what we're going to do is put D back, rearrange, and then add in new items. So E, F, G. We have replaced items with replacement. You might have guessed without replacement is the opposite. A, B, C, D. D is picked, reintroduce, rearrange until we are out of items. Order until all chosen or stops. In the single choice, we're presenting 1 at a time. We're going to measure interaction with each item. So free operant, child-led. How much time is spent with each item? Pair stimulus, we're at 2 or forced choice. Which item chosen most often? We have a hierarchy. Multiple stimulus with replacement. what order are they selected, right? Or what is chosen the most. If they're consistently picking D, even though we're adding in new items, that's a pretty clear indication. Multiple stimulus without, order until we're out of items. And then single choice, measure the interaction with each item. How long they hold it, what are they doing, are they engaging with it? What is the reason for doing all this? Well, we're trying to find potential reinforcers. That word is very important. Preference assessments don't identify reinforcers, they identify potential reinforcers. You've got to remember that. Just because somebody likes something doesn't mean it's going to be reinforcing. That's what reinforcer assessments are for. B2, skill assessments. Now, not much to say about skill assessments other than your primary role, which is to assist. Okay, your primary role is to assist in these skill assessments. Okay, and what you might be doing is probing, asking client to perform tasks. You're going to record responses, report to supervisor. All right, you might be collecting baseline. You might be taking survey data or interview data or whatever it may be. With skill assessments, you're assessing the current level and strengths and weaknesses of the client. You might be looking at academic skills, depending on where you work, maybe developmental. What about age-appropriate milestones, motor skills and language skills, SEL skills? And then what about social skills? How are they socially, right? In ABA, we're always looking at behavior, communication, social skills, okay? We're always trying to assess these things. What you're not doing is interpreting results, making recommendations, or doing these assessments on your own without guidance. Very important piece of the RBT and RBT exam is remembering your role. Now, quick checklist of a skill acquisition plan. 1, identify the skill to be acquired. What are we trying to teach? 2, we need a goal. We have to know when we succeeded. 3, how are we going to measure? Going back to our measurement at the top. 4, get a baseline. What does behavior look like before intervention? 5, implement interventions. 6, collect and review the data. 7, modify plan, and then create a maintenance plan if at all necessary. B3, functional assessments. 3 main types: indirect, direct, functional analysis. Direct and functional analysis are direct observation of behavior. We're actually watching the person perform their behavior. Indirect assessments are not. We are not directly watching the target behavior. Therefore, we should never make final decisions off of indirect assessments alone because we aren't actually observing. We are collecting information through interviews and surveys. We're asking the parents, the teachers, the siblings, what have they seen? What are they worried about? What do they think or believe about the behavior in question? Very important to get that information as far as history goes. Okay, it's a good place to start for history. Again, not good enough to actually make a bunch of decisions about, but it does give us a history. It gives us some opinions and insight and perspectives of behavior from people who know the client the best. Then we go into our direct assessments, and oftentimes this is where you come in as the RBT, where you're going to do a lot of ABC recording, right? ABC recording in natural environments, a lot of probing, okay? A lot of identifying environmental consequences, identifying patterns. This is what you typically think of as an RBT and your role. And then the functional analysis, all right? The least often talked about as far as it goes for you, the RBT, just because you're at most going to be assisting. The functional analysis is where we actually confirm function through testing. We're manipulating antecedents and consequences. In other words, if I think my function is escape, what I might do, antecedent is give work. If the behavior is the client engages in crying, then with the functional analysis, we'll actually let them escape and manipulate the consequence. And if the behavior stops, we can start to confirm escape is the function. And now you might see why it's important that you aren't doing functional analysis on your own, because we are actually going through the process of reinforcing behaviors, but we're doing it with a purpose and we have a reason to reinforce the behaviors. We're not just going through it randomly reinforcing things. So always ask or get a training on a functional analysis if you don't understand how they're done. What is ABC? What's our antecedents, our behaviors, and our consequence? So like we just talked about, let's say our antecedent is teacher gives worksheet. The behavior is Johnny throws it. The consequence is teacher removes it. Now we're going to see what happens to Johnny's behavior in the future. Okay. What if he gets out of work? Maybe he continues throwing that worksheet. These are the patterns you're looking for. Probing is just asking a client to perform a task to assess current skill levels. You're not providing feedback. You're not providing training. You're just asking them, can you do it or can you not? Domain C, behavior acquisition. It's the largest section, okay? And it makes sense as we start with one of our principles, reinforcement, okay? Now, positive reinforcement. I almost removed the word good in aversive because it's not necessarily how we identify reinforcement, right? It's not about what is good or aversive. It's about how the behavior changes. What do I mean by that? Reinforcement positive or negative, will always lead to an increase in future behavior, okay? No matter what. If it's not increasing future behavior, then it is not reinforcement. Positive, we're adding something as a consequence. Negative, we're removing something as a consequence. So let's say we have child says cookie. The consequence is gets cookie. In the future, if the child says cookie more, it's reinforcement. Child complies, demand removed. In the future, if child complies more, reinforcement. You get the idea. Reinforcement always increases behavior. If it's not reinforcement. How should we handle reinforcement implementation? You want to reinforce immediately because you want to make sure you're catching the target behavior. It's also called contiguity, closeness of reinforcement. It's very important you're not waiting to deliver reinforcement because other behaviors can happen and you might unintentionally reinforce something rather than the actual target behavior. What does it mean contingently? Well, only when target behavior occurs. The contingency is an if, then statement, right? First, then. If you do this, then you get this. First you do this, then you get this. The behavior is contingent, or the reinforcement is contingent on the behavior. We're using contingencies constantly, right? We're not trying to give out reinforcement for free unless we have a non-contingent system, but most reinforcement will be contingent. It's going to depend on schedules, and it's going to depend on the behavior occurring in order to receive reinforcement. So what are our schedules of reinforcement? Well, we have 4, but we're going to include continuous, even though continuous is FR1. But it's important to know the only type of continuous schedule is an FR1 because every occurrence, the behavior gets reinforced. Most of the time, it's for new behaviors when we're just trying to strengthen it. When B.F. Skinner, the kind of father of ABA, worked with his pigeons, and he was just teaching them, then every single time they pressed a lever, they would get reinforcement. That's continuous. Our 4 major ones, however, are down here. We have fixed ratios, variable ratios, fixed intervals, and variable intervals. Fixed ratios just means after a set number of responses. Fixed intervals is first response after set time. Variable ratio after varying responses. Variable interval after varying time. So you can start to associate words. Ratio is a response. So when we have a ratio schedule, we're looking at responses. Interval, we're looking at time. Fixed means it's not changing, it's set, okay? Variable means it's varying or on average. So if you're ever stuck, break it down. I have a fixed schedule. What does that mean? It means it's not changing. It's an interval schedule. Okay, I'm looking at an amount of time. Fixed ratio is usually where we start, right? For maintaining or strengthening behaviors, okay? Variable ratio is the strongest. It's the slot machine effect. And then when we want to move to time-based, then we have fixed and variable. Time-based is harder because it's not based on how many responses. It's based on responding after a certain amount of time. Variable ratio remains the strongest, however. So a couple examples here. Fixed ratio, every 3 responses, it's fixed. Variable ratio is an average of 5. Fixed interval, after 2 minutes, the first response. Variable, after an average of 3 minutes, the first response. What are our different reinforcement dimensions? Well, we have magnitude. That can be the amount, right? Magnitude and intensity are really used interchangeably. We have enthusiasm level written. Some people like to describe it like that. That can be tricky, right? Because how do we identify enthusiasm? But magnitude is what you're typically going to be dealing with. So you're looking for an amount, right? Or let's say an idea of quiet versus loud. What is the magnitude of the screaming? Is it loud? Is it quiet? Long or short? Was the behavior long in magnitude or short in magnitude? Okay, so you're kind of giving more context to the topography and function. Okay, that's where magnitude and intensity comes into play. And when we're talking about it as far as reinforcement goes, then we want to have reinforcement where the reinforcement magnitude should kind of mirror the schedule. 1 M&M versus 5. If you give 5 M&Ms on a continuous schedule, that means after 6 responses, they've eaten 30 M&Ms. So you've got to be careful because you want to prevent satiation of reinforcement, okay? And then intensity. Do they care about the reinforcement at all? And that's where our preference assessment and reinforcer assessments come into play. All right, moving on to conditioned reinforcers. Now, what is a reinforcer? We're just going to repeat it, right? It's a consequence that increases behavior, okay? Different types. We have unconditioned, or our primary. These have biological value with no learning. We need food, we need water, we need sleep, we need warmth, we need shelter, we need protection, okay? We are biologically programmed to need these things. In ABA, we're going to condition a lot of our reinforcement, where we take a neutral stimulus with no value, like a token, and then we pair it with other things. Money is the best example to remember conditioning. If I give a 3-year-old a $100 bill, and they haven't learned what money is, then to them, it's a piece of paper. They might identify it as money, but they're not going to know how to spend it. They're not going to know what they can get for it. They're not going to know the value. And they might not even want to work for it, because how are they going to spend that money? That's why tokens are so effective with younger age, really all ages, but tokens are very easy to understand. I've got a Paw Patrol token that I've paired with a reinforcer, let's say a brake or an iPad. Those tokens become like money. They become very reinforcing through pairing of tokens and the backups. Praise is very powerful. We always want to be pairing praise with all of our reinforcement. You want to get to the point where your praise is a strong reinforcer just by itself. What about a generalized conditioned reinforcer? Well, generalized conditioned reinforcers means they can exist in a lot of different environments and they're used throughout. Okay, so money is something that's paired with a lot of backup reinforcers and is powerful in all different types of situations. Tokens, if done right, eventually gain those properties and become powerful in all different types of situations. So how do we establish this? How do we pair? Well, we repeatedly present neutral stimulus with established reinforcer. So saying good job and giving cookie, eventually good job becomes reinforcing. Some people say, well, you want to deliver the neutral stimulus first or the conditioned stimulus or whatever you're pairing it with. You want to present them at the same time if possible. So you want to say job and give cookie repeatedly together. And if the cookie's reinforcing, eventually good job will gain those properties. C3, discrete trial teaching. This is the most famous form of ABA teaching and one you will be doing quite a bit, especially with our young learners. Discrete trial teaching has some important parts, okay? We give an SD, we wait for a response, we give our consequence, we pause and go to the next trial. Now, what are we missing here? Well, right between the SD and the response is sometimes a prompt. And our prompt always goes before the response. Do not prompt after the response or after the consequence. The prompt is before the response, after the SD. Why do we pause? We can reset real quick and then move on to the next trial. What are the benefits of discrete trial teaching? Well, you can do trials in a short amount of time. When you get good at it, and if you've got a very compliant client, you can do 10, 20, 30 trials in a minute. So it's a lot of teaching, a lot of feedback in a short amount of time. It's very easy to take data and measure, and we're systematically building skills. So very good for new skills. Different types of trials. We can do distractors, where we mix one target with unknown choices. We can use random rotation, alternate mastered and new targets. And we do maintenance, where we take mastered skills and run them every now and then to make sure there has not been any regression or fading away of the skills. Discrete trial teaching, the most important part to remember is this order. You want to memorize this and know this by heart, and how discrete trial teaching will work. And what does that feedback look like? We want to specify the behavior, specify what occurred, pause, move to the next trial. You want to be quick with DTT. What about naturalistic teaching? Well, naturalistic teaching is exactly what it sounds like. We use natural settings. We try to use natural reinforcement. It's not structured. It's child-led. It's free operant in a lot of ways. We are not sitting at a table running drills, right? Drilling and killing, as some people call it. We are playing. We're in the kitchen. We're in the backyard. We're at Target. We're at the restaurant. And we're teaching. Naturalistic teaching is what becomes very fun and easy the more you do the job, okay? If you've ever watched an experienced RBT who's good at their job, they're very good naturalistic teachers. They're teaching all the time, okay? They're always looking for opportunities to teach something. A couple different types. These are really kind of interchangeable, right? Because they're both naturalistic, but we're going to break them down. Incidental teaching, you're waiting for an opportunity. So you wait for interest, you create the opportunity. Child reaches for a high toy, for example. How do we teach? Well, we want to teach language here. So you prompt them to say help. You give them the toy. Bring it full circle. We've now hopefully reinforced help, and hopefully that behavior increases. As you go through your study guide, start combining the ideas together. And then throughout your day, think about these ABA terms and how they apply to your real life. You're working with human behavior. All this stuff applies to you as well. What about natural environment training? It's a little more structured, right? Where we're going through more daily routines and we're planning it. It's still natural, but we're anticipating it. We're planning it more. We're using all the environment. So if you ever done, or if you ever do, let's say a long session, 6, 7, 8 hours all day, and you're going through the whole day with your client, you're going to be doing a ton of NET because you're going through their whole day and you're always going to have stuff to teach away from the table just naturally. So let's say you're just teaching colors during snack. What color is your apple? What color is your plate? So on and so forth. Teach prepositions during play. The car is under the table. And you can do this just by talking, right? Describing what you're doing. That's the beauty of naturalistic teaching. It can be very fun. You can do it while building rapport, and you can be very creative with it. DTT is not creative. It's structured. Naturalistic teaching, you can be creative. It's great for social interactions because it's hard to contrive that. Safety skills, attention seeking, accessing items, and of course being in the real world. Restaurants and schools and plays and churches and stores, wherever they go in a natural environment, NET is a good idea to use. It's going to be hard to do DTT in a grocery store. C5, task analysis and chaining. Important thing to remember. The task analysis comes first, followed by the chain. The task analysis creates the chain. The task analysis breaks the complex skill into sequential steps. Washing hands, probably the most common example. Wash hands, okay, we have a behavior. How are we going to make a chain? Well, we'll analyze that. You can watch yourself wash hands. You can watch somebody else who is competent at washing hands. And then you make steps. How many steps in washing hands? And that's going to depend on your client and their needs. So there's no set amount of steps in a chain. Once you've analyzed it, you now have your chain. So hand washing. Step 1, turn on water. Step 2, wet hands. 3, apply soap. 4, rub hands. 5, rinse. 6, turn off. 7, dry. Okay? 3 ways to teach. Forward, backward, total task. Forward is the traditional way. You're teaching the first step, turn on water, and they must do that independently. You then prompt through the rest. Once they can do 1 independently, we need 1 and 2 independently. Prompt, prompt, prompt. 1, 2, 3, so on and so forth till all the steps are done. What gets reinforced? Each step after independence. So 1, then 1 and 2, 1, 2, and 3, so on and so forth. Backward chaining. When would you use backward chaining? Okay. The main reason you might use backward chaining is if you have an issue starting a task or you deal with a lot of escape. Because what you do with backwards is you go through the whole task with the client and then you teach the last step. What that allows is the client to get help to start, go through it quickly, and then have the last step done and escape for reinforcement. They always end hopefully with success because they're always finishing and exiting the skill. And then you just move backwards. So you prompt to 7, do 7. Prompt to 6, do 6 and 7. So on and so forth. Total task. Teach all steps from start, prompt as needed. So here we're teaching all the steps. You might do this if they're already competent, if they're a quick learner, if the skills, if you know there's only 1 or 2 steps that need to be worked on. You're going through the entire chain, start to finish, prompting as needed and teaching each step as needed. So if you have an issue with only applying soap and turning the water off, then total task will be a good place to start because this is already completed. We can work on this, completed, work on this, completed. And the fourth one, which you don't necessarily need to know but will add, is a task chain interruption where we've taught the skill, task chain interruption strategy. We've taught the skill, the chain is mastered, and now we interrupt the chain. So let's say I move the soap to a different location. What are we doing? We're trying to evoke new responses because obviously chains aren't always going to be the same every time because we don't have that kind of consistency in real life. C6, discrimination training. Discrimination training, we're teaching the client to respond differently to different stimuli through differential reinforcement. In other words, do you know where the circle is? Here. Do you know where the square is? Yes. You can discriminate between shapes. And that's what you're teaching. How to identify different stimuli through differential reinforcement, which we're going to talk about. How does that process work? Well, we're going to reinforce correct response to target. So if my SD is point to circle, if they point to circle, what are we going to do? Reinforce. And this, okay, becomes our SD. Withhold reinforce for incorrect responses. These are our S deltas, right? Meaning these should signal no reinforcement is available for touch circle. Again, it's all coming together. I say touch circle. Client touches circle. I reinforce. This becomes the SD. The signals that when you touch circle, you get reinforced. And that's discrimination training. It's very, very straightforward. What about if I want to teach red? Well, let's say touch red with the red and green cards. So this is a red card. This is a green card. Touch red, reinforce, green, extinction. We're going to talk about differential reinforcement in a second. Client learns that when you say touch red, reinforcement's available here and it's not here. So what are they going to do? They're going to start touching the red card when you say touch red. That's how this is done. C7, prompts and fading. You want to get very good at prompting. Let's repeat. Where does the prompt go in our chain? It goes here. It becomes a temporary SD. The biggest mistake people make is they want to prompt over here. They want to prompt over here. The prompt is an antecedent, okay? It goes before the response. It becomes a temporary SD, which is why we fade it. Now, the prompt hierarchy. We're going from a most to least intrusive. It typically looks like this, where we have a physical, the most intrusive, modeling, and then gestural, positional, and verbal are a lot of times interchangeable depending on the client. But for the most part, physical will be most intrusive, modeling least. So if we're going to use our prompt hierarchy, we're going to use this kind of hierarchy based on what type of strategy we want to implement. So let's first look at the different types. We have errorless. Errorless is exactly what it sounds like. You are prompting as much as needed to prevent errors. And that means no errors should happen at all. That's literally errorless. Least to most. Least to most means I'm starting at this side of the prompt hierarchy, right? And essentially asking them to do the response without prompting at all, and then moving this way. Most to least, we're starting with the most intrusive, which would be errorless or physical, and moving the other way. Pretty straightforward. How do we fade, and why do we fade? We want to fade prompts because we don't want prompt dependencies. Again, the prompt becomes a temporary SD, and we don't want the prompt to be the SD. We want the SD to be the SD. So how can we fade? If we're using errorless, you can start with that full errorless prompt, and then you gradually fade. So maybe from physical to model to gesture. Least to most, we can start minimal, as little prompting as needed, and only increase if necessary. Stimulus fading, we're changing teaching stimulus to natural. So if we were teaching a penny and we colored it bright yellow, for example, well, eventually we want to remove the yellow and make it a real penny. Or time delay, increase wait time before prompting. Okay, and this is an important one. When you first start prompting, then you may want to prompt immediately. But as time goes by and they've started to respond independently without the prompt, you want to give them more time to respond on their own. What is this idea of stimulus and response prompts? Well, stimulus prompts, we are changing something about the stimulus. Response prompts, we are helping with the actual response. Okay, so is your prompt focused on the response or the stimulus? What to avoid? Inadvertent prompts. Accidentally looking at the correct answer. Putting the targets in the same order every time. Always using the same language, pointing to something on accident. Okay, you want to avoid that as much as possible. And then prompt dependency, we just talked about it. That's why we fade. Client waits for prompt before responding. C8, generalization. Generalization is extremely important. If the client is not generalizing, we're not doing our job. Why is generalizing so important? Well, generalization means what we're teaching them in the clinic or the home or wherever we're teaching is occurring in real locations. If I teach you how to order food at a restaurant using a fake restaurant at your house, does it really matter what we do if you can't go out to a restaurant and do that? No. So we have to generalize. And we don't wait for generalization. We program for it. We teach it. Now, what are the different types of generalization? We can generalize across settings. So use this toilet at home and school. What about people? Very important. Follow instructions from mom and teacher. This one can be very tricky. Materials. Identify blue across shape and objects. Remember our discrimination training. If this is our blue card and this is our yellow card, then you don't want to just keep doing the same cards. How about a blue, car, right? That way, we know for sure they're learning blue and not just the card. Don't get stuck on the same stimulus for 3 months and then forget that, I'm teaching blue, not blue card, okay? Behavior, we can generalize to different types of stimuli, and it can occur at different times. Generalization can occur in a lot of different ways. What are our main two types? Stimulus and response. Stimulus generalization. We have the same response to similar stimuli. So I see a white rat, a white rabbit, a white pigeon. What do? I jump in fear. Okay? That jumping in fear is generalizing to these stimuli. Response generalization, kind of the opposite. Different responses to the same stimulus. Somebody says hi, I say hi, hello, wave, right? 3 or more, or just novel responses. That is generalization. How do we promote it? We can teach in multiple settings with multiple people. So if you're in a clinic setting, use your resources available, use different materials, change your SDs, change different aspects of the environment, teach naturally if we can. Can we go to the natural context? Can we actually go to the restaurant, for example, in order? Vary the reinforcement schedules and actively reinforce when it occurs. Now, something to remember, these decisions are going to be based on what the BCBA wants, right? And they're going to program this and you're going to implement. They program, you implement. That's kind of the team aspect of this job. C9, acquisition versus maintenance. What is the difference? Well, acquisition, we're teaching new skills. Maintenance are learned skills. We want to achieve maintenance, especially if you work with children or even adults on the autism spectrum. They a lot of times tend to regress quickly, and we don't want that to happen. We want them to maintain what we've taught them, so we don't have to go back and teach them a million times. So for acquisition, what type of reinforcement do we want to use? Well, typically continuous, okay? Because we're teaching a new skill, we want to strengthen it, we want to reinforce a lot. As we move to maintenance, we want to fade out that reinforcement to more intermittent. So I might go from an FR1, FR3, let's say like a VR5, right? So we have faded it out to more response efforts required and less reinforcement is being delivered to hopefully mimic the real environment. Frequency. Well, we want to practice acquisition all the time. Once it's mastered, we want to run maintenance every now and then. Prompting, we want to use more prompts for acquisition. Maintenance, you really hopefully should not be using prompts at all. Feedback and acquisition. We want to be immediate. Maintenance, we want to be much more natural about it. Lots of trials and acquisition, much lower in maintenance because the skills should already be learned. And acquisition, the goal is to establish. Maintenance, the goal is to retain. You always, always, always want to run maintenance trials. Now, match your procedure to skill level. Using the wrong procedure wastes time or prevents learning. Again, this is something you and your BCBA are going to work together to identify what is best for your client. It's always what we're asking. What is best for our client? Shaping, very important one, okay? We are shaping all the time. Don't get discouraged if the learner is not immediately getting what you want them to learn. What you need to do is look at the approximations. Are they close, right? Are they moving in that direction? That's the whole idea of shaping. Can we get through approximations of behavior toward that terminal final behavior we want to see? So how does shaping work? How do we do it? Well, we want to identify our final goal. What does the final behavior look like after shaping is done? That's our ultimate goal. What's our starting point? What's our current level? That's where probing comes in. Probe for current level. Want to plan intermediate steps. So let's say I want to teach somebody to, I don't know, here we go, bubbles, okay? Let's say right now they can say buh, and that's it. Well, my intermediate steps might be bub, and then maybe the full word, okay? So I'm determining my starting point, which is buh. I'm planning my intermediate steps as we move through, and then reinforcing each approximation. And each step is an approximation. Once I move on to this step, I want to try to avoid reinforcing this. I want to start reinforcing this, so on and so forth. Stop reinforcing previous approximations as quickly as possible when that new approximation has presented itself. So we only want to reinforce current target approximation. Now again, when we say this, right, we still want to be smart, and it still is dependent on our client and their needs and what your behavior analyst says. But for the most part, if the client has moved on with approximations, your reinforcement should move on as well. You can also shape magnitudes, so durations and distances and lengths and quality, and that's a little more advanced, but you can, if they learn bubbles, for example, you can shape it to be louder, You can shape it to be quieter. You can shape how they pronounce it, how they say it, right? So not only can you shape to teach a behavior, but you can actually shape the final behavior itself. Token economies. You will do a lot of token economies, and you will do a lot of establishing token economies. And with the help of your BCBA, they will be designing the token economies. And going back again, everything starts coming together. Token economies, how does it start? We have to select our tokens, and then they're neutral, right? They're a neutral stimulus. We pair them with reinforcement to create what? Conditioned reinforcers, which are our tokens. And tokens can really be anything, okay? We just want to make sure that the tokens are easy to use, easy to carry around, okay? Easy to gain access to, easy to use in a lot of different situations. And you certainly can create tokens based on preference of the client. There's nothing wrong with that. But the most important thing is we do pair with backup reinforcers. Token schedule is typically going to be whatever your reinforcement schedules are. And then the exchange rate, how many tokens needed for each backup reinforcer. So if our schedule is a FR2 and we need 5 tokens, well, we might do FR2 times 5 to get, I guess we would do what? Probably 3 to get 6 tokens, and then we can exchange for the backup. So how do we set it up? Again, what's our target behavior? What is our delivery schedule? What are our backup reinforcers? What are we exchanging for? Make sure they actually care about it to exchange their tokens for. This is going to typically be designed by your BCBA, but of course you will be doing the implementation, and a lot of times you will be doing the pairing itself. Now, the one punishment that is tied to the token economy, and it can be used in other situations, but it's most often associated with it, is this idea of response cost. So response cost is removing an earned token or reinforcement for problem behavior. So if I have 4 tokens to a client and they need a 5th to get their backup reinforcer, well, response cost says if they engage in a problem behavior, hitting, we take one of those away. That's response cost. It can be very, very, very strong, but it is a punishment procedure. We have to use it with caution. What are the benefits of token economies? We can bridge delays in reinforcement and in activities because the tokens are functioning as that reinforcement until they can actually exchange them. Easy delivery. We talked about delivering reinforcement immediately. Less satiation because we can use a variety of tokens. We can have a variety of backups. That's the beauty of a token economy, is you can actually create a real economy like a store where they can exchange a certain amount of tokens for bigger and better things or maybe small things. It just depends. Token economies can be very, very fun and creative and effective. Okay, moving into domain D, behavior reduction. Very similar to acquisition, right? Except now we're going to start reducing those things like punishment and extinction. We must start, though, with the functions of behavior. Functions of behavior, when you see a new behavior, when you're trying to think about a behavior, first things first, why is it happening? And that's your function. Behavior typically works to gain or get rid of something, and our 4 main functions are escape avoidance, attention, tangible, and automatic sensory. Escape avoidance is exactly what it sounds like. The client gets out of or avoids a aversive or situation they don't want to be in. Attention from others, right? Even negative attention, all types of attention. Attention is very easy to, an attention-based behavior is very easy to create and it can be hard to stop. Tangible, access to item or activity, different from attention. This is an actual tangible thing they can hold. And then automatic. It says internal reinforcement. In other words, it is not socially mediated, okay? These are socially mediated, meaning somebody is actually delivering the consequence. Automatic and sensory is alone. There's nobody else delivering the consequence. It can be very hard to target that for that reason. So an example of escape, Johnny swipes materials, materials are removed. Attention, Johnny screams while you're on the phone, you respond. Tangible, Johnny slaps face, mom gives a cookie. Automatic, Johnny chews toys for oral input, Sarah rocks around for calming. Behaviors can have different functions for different people or contexts. Behaviors can have multiple functions. We're trying to keep it as simple as possible in this case, where what is your hypothesis about the main function? We can do a functional analysis and narrow it down, but if you had to say one main function, what is it? Antecedent interventions. Antecedent interventions are preventative. This is before behaviors. So we have antecedents, behaviors, consequence. We're trying to prevent the behavior from occurring with an antecedent strategy. Now, different types. Non-contingent reinforcement, whereas contingencies are the behavior is leading to reinforcement. With non-contingent reinforcement, the behavior doesn't matter. It's about time. It's a time-based schedule regardless of behavior. So, for example, if attention maintained, give attention every 5 minutes regardless. In other words, if the function is attention, you're giving every 5 minutes regardless of behavior. Why will we do that? Well, it has to do with motivating operations and trying to reduce the motivation to seek attention because we're giving it for free. High probability request sequence, the high P sequence, the high P low P sequence, whatever you want to call it. We are presenting several easy known tasks we know they can do before a difficult one. And when you're choosing high P sequencing tasks, you want to make sure they can actually do the task and do it reliably. So, give me a high five. Touch your nose, clap, do or start your worksheet. Trying to build up behavior momentum. Demand fading. Start low demands, gradually increase. And we're really fading in here, right? So start 2 easy tasks, increase to 5, then 10, and this is also having an effect on the reinforcement schedule. So what we're trying to do is change up what happens before the behavior even occurs. A lot of times it's preventative. Other ways to prevent, we can use environmental modifications, remove triggers before session, arrange it to be productive. Motivating operations, we can deprive to increase value of consequences, or we can satiate to decrease the value, like we do with non-contingent reinforcement. We can provide choice, very powerful, always give choices. And then visual schedules are great as well. What about a consequence intervention? Well, a consequence intervention, the behaviors occurred, so now what are we doing? We are reacting. This is reactive, okay? We are just reacting to the behavior instead of trying to prevent it. Differential reinforcement, incredibly important. Differential reinforcement says, I'm reinforcing a target, putting everything else on extinction, okay? 4 you need to know. DRI, DRA, DRO, DRL. Incompatible, alternative, other, and low rate. Let's start with these two. The key characteristic of these two is we are teaching a replacement behavior, okay? So, DRI and DRA are the same. You have your target replacement, what you're reinforcing. You're putting the old behavior on extinction, right? And the only difference is with a DRI, behavior cannot occur with the problem behavior. So the topographies cannot overlap or exist together, okay? Kevin elopes, you reinforce him sitting. You can't sit and run away at the same time. Those are incompatible. DRA, we're picking a more appropriate behavior, right? But it has the same function. It's what we call functionally equivalent. Karen screams, answer. How about we reinforce raising hand? So in differential reinforcement, if Karen is screaming, we put the screaming on extinction. We don't call on her, but we do call on her for raising her hand. DRO, absence of problem behavior for set time. So with DRO, we are not teaching a replacement. We're just identifying a problem behavior and reinforcing for it not happening in the absence of that behavior. So Julie pulls hair. Reinforce if no pulling for 3 minutes. Okay? In the absence of hair pulling, we are going to reinforce. We're not teaching a replacement here. Doesn't matter what's happening. We're reinforcing for it not happening. DRL, behavior at a lower rate. We are trying to choose a behavior where we need to reduce how often it happens. Good one is questions. If somebody's asking 20 questions an hour, we just have to reduce it because it's not socially conducive, then we're going to reinforce, let's say, for less than 10. In all instances, we are reinforcing a target, putting other behaviors on what? Extinction. And then finally, functional communication. We are teaching appropriate communication, okay? Why is this considered differential reinforcement? Well, because instead of hitting to escape, we'll put that on extinction and we'll reinforce bright please, okay? This is targeting appropriate communication that is teaching or reaching the same function as the old behavior. So we know what reinforcement is, right? We're trying to increase. What does extinction do? So extinction decreases. Extinction always decreases. We're no longer reinforcing previously reinforced behavior. In other words, withhold reinforcement. We want to do this based on the function. So we're not ignoring the child, okay? A lot of people think extinction just means you ignore the kid. Extinction means you are focused on the behavior and not reinforcing the behavior. So if it's attention, then we may use planned ignoring, okay? We're not going to give attention to the behavior that is seeking attention. If it's escape, we're not going to ignore the kid because we don't want to let them escape. We may continue presenting that demand until escape is no longer available. Tangible, we just don't give the item. This might be the easiest. We just don't provide the item, okay? We don't have to ignore the child. We just don't give the item for the behavior that's seeking the item. Huge thing for extinction. It has to be consistent. If you're going to do extinction, everybody needs to be on board. You, the BCBA, the teacher, the parent, everybody. The worst thing that can happen is we do extinction inconsistently because now reinforcement is being delivered intermittently and we're actually changing the reinforcement schedule for the worst. We also have to know the function. Extinction is going to be function-based. Expect an extinction burst. What is an extinction burst? So an extinction burst, okay, is a situation where we have a behavior, let's say it's here, and then right here, we start extinction. We expect the behavior to temporarily do what? Increase, burst, and then we go back down. So it's that temporary increase in behavior once extinction starts. We can plan for it. We know what might happen. What else to look for? Well, once that behavior decreases and extinction is effective, a lot of times what will happen is it'll come back temporarily, and we call that spontaneous recovery. We just re-implement extinction from before. Also, it may not be appropriate if behavior is dangerous, but that is ethical questions that will be answered by you and your BCBA, depending on the client and their needs. And then punishment, our last main principle. What does punishment do? You guessed it, it decreases, okay? Reinforcement increases behavior, future behavior. Punishment and extinction decrease future behavior. It should be a last resort. Always pair with reinforcement for appropriate behavior, right? So we never want to use punishment alone because if we're going to remove something, we want to add something in its place because the behavior is happening for a reason. Extinction is typically used with differential reinforcement, but punishment is not tied to it necessarily. However, we still should be using reinforcement and not just punishing. Punishing is typically a last resort. Two types: positive punishment, we're adding an aversive. Negative punishment, we're removing a reinforcing or preferred stimulus. And as long as behavior is decreasing, it's punishing. So reprimand, extra chores, firm no. If those decrease behavior, that's a punishment. If those don't change behavior, those aren't punishments. So it's hard to give examples of reinforcement and punishment because we don't just assume it's punishing. We've got to look at how it changes the behavior. Very important to remember. Negative punishment, timeout, response cost, loss of privileges, all removal of something. Different timeout types. We have exclusion, remove client from the area. Seclusion, separate room. and typically for serious behaviors. And then non-exclusion, stay in the area but can't access reinforcement. So let's say two kids are fighting over a toy. You take away the toy, but they can still play. Side effects of extinction and punishment. Very important to consider the ethics behind extinction and punishment and why we want to be careful when using these. They can be dangerous. They can cause a lot of harm, especially to young children and adults as well. But a lot of kids get very damaged from improper use of extinction and punishment. So we have to be smart about it. First, the extinction burst, like we talked about. We know the behavior is likely to increase in the beginning. It's expected and it's working, but we have to prepare everybody for it because it can be dangerous. It can be hard to go through an extinction burst. Response variation, right? Trying different forms of behavior. So children, if something's on extinction or is being punished, a lot of times they'll create new behaviors in order to meet the need, right? Because you're taking away a functional behavior, which is why we want to choose and get ahead of the game and choose our own preferred replacement instead of letting them figure it out. Resurgence. Old problem behaviors temporarily reappear following the removal of reinforcement from the new behavior. How is that different than spontaneous recovery? Well, with spontaneous recovery, okay, old problem behaviors just reappear. Resurgence occurs where old problem behaviors temporarily reappear following the removal of reinforcement for the replacement behavior, okay? And I'll go back and clarify that on the study guide to make that extremely clear. So I'll update the language to make that very clear. One great thing about this study guide, if you buy from us, is that we're always updating it and it stays organic. If you buy from other physical copies from companies, it's done, right? Here, we can modify it and make it better and better and better. So I'm going to clarify better resurgence and spontaneous and add a couple of lines into the study guide so it's easier to understand when you're studying. Emotional responding. Punishment can lead to emotional outburst, right? Extinction can as well. So frustration, aggression, crying, especially from a lot of times kids who you don't see this often. If you start extinction or punishment, you can get some of that emotional responding. Now, what can punishment do? Again, emotional responses. You can pair yourself with punishment, and that becomes a big issue. You've got to be very careful. You can create escape and avoidance behavior. Nobody wants to be in a situation where they're being punished, so they start to escape or avoid those situations altogether. Aggression may occur, and then they may imitate that behavior with others. If you've worked with kids who go to school, sometimes you might hear them imitating their teacher, maybe reprimanding one of their classmates, right? It happens with my daughter all the time. She imitates teachers or whoever, and they're just imitating what they hear and see. So we've got to be careful about how we're using punishment. Punishment really should be chosen last on average and typically. D7, crisis emergency procedures. Who's going to write the crisis emergency? Your BCBA. They're going to train you on it, okay? And then you need to be familiar with it, know who to contact, understand your role and limitations. Don't think just because you've had a client who's been amazing for 6 months that some people don't have bad days, okay? Don't ever get complacent. That's how bad things can happen, all right? And the crisis emergency procedure is there to protect you, the client, and the environment. What are some strategies we can use for a crisis or emergency, which is when someone is in danger? Again, could be you or the client or somebody else. Well, if they pull hair, maybe wear a hat, wear your hair up, keep a safe distance, redirect hands, come in prepared, essentially. Biting or scratching. Long clothing, safe distance, push into bite, don't pull, okay? And you should be taught all these things, okay, in the field. Throwing, understand what's clear. If you know you have a thrower, don't fill up the table with items. I've seen it time and time again. Think ahead, okay? Hitting and striking, block attempts, move away, wear protection on your arms and on your legs, okay? You've got, this can happen sometimes, okay? You've got to be prepared. Don't just go in unprepared because, I'm going to get hit again. start making adjustments, okay? This is the whole beauty of ABA is we can make these adjustments. What about physical restraint? You should avoid physical restraint by any means necessary, especially if you're not trained and qualified to provide that physical restraint. Okay, there are laws around restraint. There are rules around it. You must be absolutely certain or else you risk a lot of trouble. If you are ever using restraint, discontinue it as soon as everyone's safe. Don't continue it. Report to supervisor immediately and complete an incident report. Restraint is to be taken very, very seriously. Once the crisis is over, what do? Well, we want to document objectively. We want to report to our supervisor, complete paperwork, debrief, review plan. How did it go? What can we change? What needs to be improved? What did we do well? All right. And that's how everything should be. Organic, flowing, always changing, always improving. Domain E, documentation and reporting. Okay, you're going to do a lot of note taking. You're going to do SOAP notes. You're going to do reporting. And it's very important that you have good communication with your team. That could be RBTs, it could be BCBAs, it could be other therapists, parents, teachers, whoever's on the team. Communication must be frequent. It's got to be brief, right? I should say it should be as needed. Don't wait to communicate, and don't be afraid of giving your opinion to a team member or a supervisor. You are an essential part of the team. Communicate any concerns you have. Remember, always keep the focus on the client. If you think something can be better, that means something is better for the client. Say something. Team members can be caregivers, teachers, other service providers, stakeholders, anybody really involved in their lives. Your role, you're going between team members and supervisor and these other providers. What's the report? Let's say the caregiver tells you behavior plan isn't working at home. What do? Go to your supervisor. Don't give advice. Suggestions for different reinforcers. What can you do? Ask your supervisor how to proceed. Add goals. Supervisor's job. Schedule concerns. Supervisor or admin. Modifications. Supervisor. And that's going to be an ongoing theme for communication. For the most part, you're always going to your supervisor, except in cases where you're just building rapport with the caregiver, for instance, or it's a question that's not encompassing everything about the treatment plan or changing the treatment plan, then yeah, you can work through it. But if we are worried about a behavior plan not working or adding goals or modifications, that's all to be run through your supervisor. How to respond. Let me check with my supervisor. I'll pass the suggestion to the BCBA. What not to do. Answer clinical questions yourself. Answer health questions yourself. Answer school questions yourself. Promise plan changes. Make own recommendations and absolutely never guarantee results. Okay? And it's not because you don't know what you're talking about or you're not qualified to do it. It's just because we need to maintain a level of competency and a chain where in the end, that supervisor is responsible for what happens here. Okay? And that's their role and their job as a supervisor or BCBA to make those adjustments. 2, seek supervision timely. When should you seek supervision? If there's a safety, a crisis, or a medical concern, immediate. Everybody has phones now. Call, text. If something is urgent, get in touch. I don't care what time of day it is or when it is. Significant behavior changes. So let's say you get to session and you notice your client's acting very out of the ordinary. You don't necessarily need to call them during session. You can, right? You can communicate it, but it does need to be done after you leave session and at least definitely in your SOAP notes. You notice something wrong with the data, that has to be addressed same day. You don't want that BCBA to make adjustments based on poor data. Training needs, you can go a day or two. Never go longer than a couple days without speaking with your supervisor, okay? Touch base, give updates. There should be something, if you've worked with the client, to share. Even if it's good news. Good news is good news, right? Talk to your supervisor. And then procedural questions, going back to Fidelity, that kind of thing. We want to, There's a difference, right, between training and procedural. But if it's not urgent, don't wait 2 weeks to ask the question. You still want to get it in within at least 24 to 48 hours. Why should you contact your supervisor? You don't understand the procedure. Very important. You want more practice and training. Don't ever let them tell you no. That is their job to train you. Data don't make sense, right? So you don't understand something about the data. Sudden, strange behavior changes. You're not sure what to do with a parent or in an environmental situation. If you have safety or ethical concerns, of course, bring that to attention immediately. Know your direct supervisor and escalation procedures for emergencies. E3, report variables affecting progress. So in your notes, right, you can document all this, but there are some things you want to immediately alert your supervisor about, or at least same day, all right? And why are we harping so much on communication with your supervisor? Well, we're all busy, and your supervisor doesn't see the client nearly as much as you in most cases. So you need to be the eyes and ears, and you've got to have that confidence to take on that responsibility and own it. And communicating these things is part of that. So if there's an illness, very important, sleep disruption, pain, medication changes. If you've ever worked with children with autism or adults with autism, you know that these changes can really affect behavior. Environmental changes. Did the house move? Did the room move? Was the schedule changed? Did the new people come into their lives? Did they lose a teacher? Are they going on vacation? If they went on vacation for 3 weeks, can we expect behavior to have changed? That sort of thing. Social, emotional, or mom and dad stressed, right? And these are all things that need to be communicated, and they're not necessarily therapeutic notes because you're not evaluating them, but you are noticing them, and you have to bring this to the attention of the supervisor. Routine changes, life events, somebody died, mom and dad got divorced, dog died, whatever it may be. And also, if you have any of this stuff, communicate it to your supervisor as well, because that might affect how you're implementing your treatment. Other things, diet changes, especially in the field of autism, we see all kinds of new diets all the time. That has effect on behavior. Did they start new therapies? Because new therapies might impact our own interventions. Are they off of school? What has changed in that routine? We need context, okay? Context is super important. So when I go back as the BCBA and look at my data and notice a blip or an anomaly, I can go back to our notes or our conversation and say, the week they were out of school, they started a new medication, and they started a gluten-free diet. And okay, so a lot of variables changed. Makes sense why behavior might be a little different that week. So example documentation, 11/9/25, parent reported client started new allergy medication 3 days ago. Client appeared drowsy during session and had lower engagement than typical. Pretty good note. You can be more specific, obviously, but not a bad note. And you can relay that to your BCBA quickly, okay? All right, E4, objective session documentation. Objective versus subjective. What is the difference? Subjective is an opinion. Objective is a fact. What actually happened? We want to be factual. We want to talk about what actually happened. We don't want to be subjective. Client was angry. If I read that, because remember, this is session documentation, so I'm going back and looking at your notes. I read client was angry. If I'm the BCBA, now I'm not happy. Now I'm angry, right? That's not telling me anything. What does anger look like? Client hit table 5 times, pushed materials 3 times. Okay, I don't care about the state of being of anger. What did they do? Bad session. Don't use that verbiage, bad verbiage. Client completed 12 of 20 trials to 60%. Client eloped 10 times. Didn't want to work. Well, how about client turned away, said no when presented task? We get the idea. Client was happy. Client smiled and clapped after reinforcement. We're just being more specific. So when I read these notes, I'm not confused and I can make decisions about supervision, interventions, and changes. What do you want to include in your session documentation? Your goals. What did you work on all day? Data, you don't have to obviously include all your data, but any key data or changes would be important. How did the client respond to intervention? What about the antecedent and consequences? New ones, old ones, did they change? How did you collect data, if necessary? any progress towards goals, and behavioral observations you noted. What kind of requirements do you need to follow? HIPAA, okay, that's your confidential info laws. All your workplace policies. Submit your notes on time. Notes are very important, especially now for insurance purposes. Sign and date everything. Store securely. Don't falsify data. Example note, 11.9.25, worked on manding and receptive ID. Client manded 8 times using 2-word phrases. Receptive ID, 90%. Client engaged in one elopement during transition, lasted 12 seconds. Return with gestural prompt. Tokens are in 15, exchange for 5 minutes in iPad time. Fantastic note, right? Very good, very strong note. It's descriptive, it's to the point, it's concise, and it's objective. Domain F, ethics. Now, if we get an ethical update, then I will do a new video on ethics, but right now we do have a full breakdown of the current ethic task list. Go check that out, but let's get into it on here. Domain F, ethics, core ethical principles. 1, benefit others. We're doing this for others. 2, treat everyone with compassion, dignity, and respect. 3, behave with integrity. So benefiting others. Act in the client's best interest. Maximize benefit, minimize harm. Use evidence-based practices. How can we do all these things? Well, we can do these things by accepting feedback, following the plan as written, and always doing our best, having the confidence to speak up when we think something may be wrong or off, and being an engaged part of the team. We're always acting for the client. Okay, we'll have the client's interest in mind. Compassion, dignity, respect. No matter who it is, no matter who you're working with, their level of development, it doesn't matter. Treat them as you want to be treated. That's what it comes down to. Okay, we're going to talk about cultural relevance. Speak age appropriately. Don't talk to a 13-year-old like they're 2 years old. Okay, speak to them like you would speak to anyone else. Behave with integrity, honesty, follow through on commitments. Practice within your competence. Admit when you don't know. Don't pretend to know. That's how bad things happen. Demonstrate competence first. F2. Competence is knowledge plus skills plus abilities. Okay? What do you know? What can you do? How good can you do it? You do this through training, practice, and supervision. So before you provide service, get training. Demonstrate your skills, take feedback and use that feedback, practice until proficient, get approval, and go. What might signal you're not competent? Unsure of how a procedure works, you're missing steps. You're making errors, you're missing measurements, you're missing data. Client is not progressing, or you feel uncomfortable or uncertain. If you're ever uncomfortable or uncertain about an intervention, do not do it, because if you do it wrong, bad things may happen. Okay, you reinforce something you don't mean to, you punish something you don't mean to. If you're uncertain, don't do it. How can you respond? Contact your supervisor, more training, get observation, and get feedback. It's fine not to know. I don't know a lot of stuff. You don't know a lot of stuff. Do not pretend you do know. That's only going to hurt the client, and that is the number one thing we don't do, which is hurt the client and put them in the way of danger or harm. F3, ongoing supervision requirements, BCBA or BCABA meeting requirements. So that's your supervisor. Ongoing means regular supervision throughout service delivery. So every month you need to get a certain amount of supervision. You can't work on your own as an RBT. You've got to be supervised. You can't make clinical decisions alone. That's got to be made in conjunction with your BCBA. And you cannot modify behavior plans without approval. These are not your roles. What are your roles? Know your supervisor. Attend supervision meetings. Participate. Implement feedback. Ask questions when uncertain. Implement plans. Okay? What are some red flags? If you haven't seen your supervisor in months, you need to tell somebody. Contact them. Contact your boss. That is not acceptable. Do not let your supervisors never come visit you. They have to come see you on all your cases. Supervisor doesn't want to answer your questions. Again, not okay. That is part of their role, part of their ethics, part of their job. Nobody's observing your work and giving feedback. The biggest complaint I get is BCBAs don't model enough. Okay? If you need it modeled, You tell your BCBA, can you model it for me? Don't sit there in silence and build up anger when a simple conversation can make it better for everyone. F4, effective supervision practices. Good supervision includes the following. Instruction, clear step-by-step explanation with written protocols. Modeling, supervisor demonstrates the skill to you. Very, very important. Rehearsal, you practice or role play. And then you get feedback. Corrective feedback for errors, reinforcement for good steps, just like we would with clients. You must be directly observed. And if you notice, this whole section is very similar to how we work with clients. As a supervisee, you're essentially another client for the supervisor. They should treat you the same way with the same amount of care that they give the clients. What is ineffective supervision that you should be aware of? Only giving verbal instructions, never actually doing it themselves. No modeling and no demonstration. Not letting you practice. Only criticism, so not giving you feedback on how to perform better. Or infrequent contact. So why is this in the task list? To make you aware that as the RBT, you have the right to say something when you feel you are not getting what you need from your supervisor. F5, confidentiality requirements. What is confidential? Client names, identifying info. Don't leave those laying around. Don't talk about those to people who do not have permission or the right to those names. Diagnoses. What are they diagnosed with? Only business of those stakeholders who have the right to that. Behaviors, treatment info, family info, session notes, data, photos, videos, conversations about clients. All these things are protected under privacy laws. We have to seek consent, okay? And we have to seek approval before sharing these things. Photos and videos, we've got to get a release form, and we cannot post on our own personal social media any client ever. Storage rules, secure, lock locations, password protect digital files, don't leave in public areas, don't take home without authorization, shred when disposing, and we want to keep for at least 7 years. Unless you leave the company, then you're okay. Who can you tell? Well, you can, your supervisor or BCBA, treatment team with authorization, parents, legal guardians, and as required by law. Additionally, any stakeholders who are authorized to get the information, you can discuss it with. But before you do discuss it, make sure they actually have approval. Who you don't tell about specific clients, friends and family. Don't give them names and diagnoses and all these private details. People not involved in treatment. Don't talk to other RBTs about specifics about the actual client themselves. Never, ever on social media, your personal social media, and anyone without authorization. That includes schools or other therapists. Always check first. Common violations. We do not post about clients on personal social medias. Businesses are a different thing. Personals, never. Do not discuss clients by name in public. Do not leave data sheets in car. Do not leave computers unlocked. Do not tell friends about clients. Do not show client photos without consent. You could lose your certification. You could lose your job. Legal action be taken. You could harm the client. F6, public statements. So as an RBT, you represent BCBA or you represent ABA, and you're trying to set a good example and make a good example of what ABA is and isn't. So as an RBT, do not claim credentials you don't have. The big one is if you're studying to become a BCBA, let's say you're in your master's program, you can't say you're a BCBA until you actually pass that exam. Never claim ABA cures autism. Never guarantee we can help. Okay? Sometimes we can't. And ABA does not cure autism. There is no cure. Never guarantee outcomes. That's the worst thing you can do, is guarantee an outcome and then not live up to it. So something like, I can make your child speak in 3 months. You have no idea from the beginning whether or not that child is going to be able to speak in 3 months. Do not try to guarantee anything. Tell them we're going to do our best. We're going to continue monitoring the data, and we're going to make adjustments as necessary. Correct statements. I'm a registered behavior technician. I'm an RBT. I work in ABA. Okay, I do behavior therapy. ABA is evidence-based approach that can help improve specific skills. It is not a magical cure. It's also not punishment-based, right? It's reinforcement-based. We'll work together on communication goals and track progress, and we'll keep an eye on it as we go. Social media rules: never post client names, photos, session details, protected health information, complaints. What is safe to post? General ABA education, research articles, professional achievements, celebration of profession. F7, multiple relationships. What are multiple relationships? When a professional relationship overlaps with another type. So, for example, personal, friendships, romantic, family members as clients. Big no-nos, okay? Don't do it. You should not do it. You're not friends with your client's parents, okay? You were there in a business capacity. Don't buy or sell goods at session. That should be obvious. Don't engage in business partnerships with your client stakeholders or your client. Don't make financial arrangements as the RBT. That has to be run through the BCBA. Don't socialize with clients or stakeholders, okay, without approval, meaning you need to be providing some sort of service. Definitely don't socialize outside of sessions, and avoid adding on personal social medias. What are some risks? Well, the more you develop a relationship, the less objective you can be, and we've got to be objective as possible. That is the number one thing we need to do. Exploitation. They may exploit you, or you may exploit them, right? Depending on who's got the power. Unclear roles. So it might be unclear. Are you the RBT, or are you more of a family member? We never want to be in that situation. Service quality could compromise. Maybe you spend 30 minutes talking to the mom each session instead of working with the kid. And you may lose professional credibility, right? If this is found out and you've broken some of these guidelines, then that could be very unfortunate. Yeah, one last note, unavoidable small communities. If you live in a small town, it is what it is, okay? Like everything else, nobody's perfect, nothing's perfect. We're just trying to abide by the best guidelines we can. Set clear boundaries, document, minimize overlap, get supervision, transfer if multiple relationships interferes. So for example, you see a client at church. Be professional, maintain boundaries, let your supervisor know. If they approach you at church, then obviously you're welcome to talk with them, okay, in a cordial way. But don't go to brunch with them. Don't hang out with them after. Thank them. Say bye. See you next session. Always avoid babysitting, dating, all these temptations that sometimes come along, because in this field, we are very close to the families in a lot of cases, okay? And we want to just try our best to avoid any uncomfortable situations. Now, general rule for gifts. Big one as always. Avoid accepting gifts to prevent conflicts of interest. Now, the hard and fast rule is under $10. What may be acceptable? So on your exam, stick with under $10. Now, all right, if you get a holiday gift that's $12 and the client themselves gives it to you, that's going to be difficult to turn down, all right? So what we want to think about is the frequency of the gift, okay? The value, what's the intent, okay? Is it a cultural thing? And what about your policy? Typically, we want to stay under $10 and not routinely. Meaning once a year, they give you a $10 gift card, that's fine. If they're giving you something every month, that's not okay. Expensive gifts, definitely not okay. Cash, not okay. Gifts with strings attached, not okay. Frequent gifts, not okay. Gifts creating obligation. In other words, hey, we gave you this. Now, what about you work some extra days for us? That kind of thing. Gifts can be very tricky. That's why we have these strict rules. People say, well, doctors get gifts, but doctors see patients not nearly as routinely and not nearly as closely as we do. Sometimes we're with families 20, 30 hours a week. All right, we're just trying to keep it professional. How to decline. Thank you so much for thinking of me. I'm not able to accept gifts. If they continue, go to your BCBA. RBT giving gifts. Try to avoid it, right? Well, exceptions if you have approval, okay? Maybe they graduated, a birthday, therapy-related items, big celebration. Everything is case by case, okay? We have our general rules. The whole idea, and people get so bent out of shape about ethics on the exam, you've got to be by the book. In real life, it's important to do the right thing, okay? It's important to be as ethical as possible. Hopefully you understand what that means. F9, professional skills. Key skills for RBTs. 1, accepting feedback. What to do. Listen. Don't get defensive. Ask questions. Implement changes. Thanks, supervisor. Don't argue. Don't make excuses. Don't ignore feedback. Does that mean you can't give your opinion? No. You can discuss the feedback. You can give your side. If they tell you to implement, you implement. Active listening. Full attention. Make eye contact. Listen when other RBTs are talking, when parents are talking, when clients are talking. All this is information that's going to help you with the client. Seek input. Ask when unsure. Request perspectives. Value the team. Be open. Don't pretend to know everything. Don't avoid asking questions. Questions are great. Okay, it shows your thinking. It shows your learning. 4, collaborating. Work with a team. Share info appropriately. Support team goals. Be reliable. Don't work in isolation. Don't withhold information. Don't be unreliable. Collaboration is a huge part of what we do, given that a lot of our clients will have multiple therapies and schools and sports and all these other things. We want to work as a multidisciplinary team where everybody is working together, not on an island doing our own thing. Additional professional behaviors to consider. Our communication should be clear, concise, timely, professional tone. Avoid jargon. So avoid saying things like, we'll use differential reinforcement, which is a combination of reinforcement and extinction. We'll use a DRA in order to teach a replacement behavior. Blah, 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 blah. The parent's going to zone out. Just tell them, here, we're going to try to increase this behavior by providing this consequence. In the meantime, that behavior is no longer getting reinforced. We're going to see what happens. Be on time. Don't be late. If your session starts at 3, be there at 3. Don't waste the client's time. Don't waste the stakeholder's time. Be flexible. This has to be a flexible job. Your cases are going to change. Schedules are going to change. A lot's going to change. You just have to be able to handle that and anticipate that. Be a problem solver. Anybody can identify problems. Okay? Complaining about problems does nothing. Find solutions. Professionalism. Dress appropriately based on your policies and the culture and where you live, and always maintain boundaries. F10, cultural humility and responsiveness. Cultural humility is an ongoing process of self-reflection, meaning just because you live your life one way, you were raised one way, you believe one thing, that is your culture. What do other cultures believe? And depending on where you live, you may or may not work with a variety of cultures. When I worked in Las Vegas, I worked with countless amounts of cultures, right? So I was always learning, always trying to keep an open mind and trying to understand there's plenty I don't know about other cultures, how they raise their kids, etc. You're always open to learning and admit when you don't understand. Okay? That's a big one. Cultural competence. Humility is lifelong learning. You're never done. Cultural responsiveness. Adapt services to fit clients' cultural context, meaning based on the house, what the parents want. Respect the parents' wishes too. Some parents may be more strict, some less. You have to respect that. Incorporate cultural strengths. So try to incorporate as much as possible cultural practices into your ABA. That's part of learning, right? And you obviously won't be writing the treatment, but it's going to be good that you understand it and you can help maybe your BCBA better understand it. And don't impose your own values, especially religious or political. Not there for that. It's not the time or the place, okay? If you truly cannot handle it, come off the case. But for the most part, it's not the time, it's not the place. Do what's best for the client. Finally, identify personal biases. Everyone has biases. We all do. If you say you don't, that's a lie. Everyone does. Understand where your biases are and try to understand where they come from. Reflect on your background and use this to grow. Use this to learn more about people maybe you don't know much about. Okay. Recognize assumptions you make that may be wrong, and question automatic reactions. Okay. Well, the great thing about what we do, it's based on observation and data. Okay. Good one. I assume the family would want eye contact, but in their culture, children show respect by looking down. Or the opposite. I assume they didn't want eye contact, so I didn't give them eye contact. Don't assume anything. What can you do? Ask or observe. And that will do it. That wraps us up for our 3rd edition study guide. Again, terms and ideas are the same, okay? I think this study guide's better written. As far as the task list items go, it's clearer on what you need to study. And so I like the updates they made to the 3rd edition. Like I said, we are always going to be updating the study guide. And when it's updated, you will always get the new version once you make a purchase. We will include this in the current combo pack. And so moving forward, you will have this in all the combo packs. Shortly, we'll have our 3rd edition practice exams as well. Those will be coming out hopefully in the next week or so. This is November 2025. So for sure, beginning of December, we'll have those ready to go. As always, any questions, let me know. Thank you so much for the support. Share. We love word of mouth. It means so much to us when you tell us you've been sharing videos, leaving comments. It's the best. Okay. Other than that, I think that's all. We'll wrap up. Work hard, study hard, and I'll see you soon.